This patient has come in to see me, and what she has an issue with is how her midline has come this way here. Now, the patient has had orthodontics before. That means she's had braces before. There's been a little bit of movement. And we have a young patient, mid-20s, that kind of age. The thing that I notice a lot that my patients don't notice sometimes is actually how their teeth may have changed over the years. And what I can see is that she's got some chipped and worn edges. And I think that's because of how tall her front teeth are, and that's causing a functional issue. So we have to figure out an aesthetic goal and a functional goal that's going to deliver a result that actually is harmonious with the rest of the smile, but actually functions better so she doesn't get tooth wear in the future. Really important for a younger patient to avoid those kind of problems going forward. So the first step is get into temporaries, and if we look at the temporaries for this case, they're fully handmade. And what we're trying to do is we're trying to blend the front aesthetic zone with the side aesthetic zones. And this is really important, because if we don't blend a result like this, we're going to find that 4 teeth that we're treating are not going to fit with the rest of the smile. So either we have to commit to more restorations, which of course we can deliver a much better aesthetic with more veneers, but this patient is quite happy to accept some of the irregularities at the side. And if I can get a functional and aesthetic result with just the 4 teeth, well, actually that's going to work for her in this case. Sometimes it's not the right thing to do, but here it was a good option. So those temporaries we've tested, we're making sure that the function works and the look of it works. And then we move on to the final restorations. And what you'll see is the blend of the final veneer is extremely good compared to the natural tooth. This involves an artistic eye from my ceramist. It involves instructions, and it involves a blueprint of temporaries that we're able to design so that we can get a nice shape, we can get a nice reflection, and then it's about delivering the right depth and thickness of a veneer that allows us to actually produce translucent effects. And you can see the blend between the front teeth and the other teeth is nice. So this is an example of using just a few veneers to actually deliver a minimal, functional and aesthetic result, and also just improve just a crooked smile.